Thank you so much, those who have joined today for this session. The purpose of the grand rounds is first is the knowledge, update a new evidence, guidelines, technologies in a core and a subspecialty topics. We always feel that enhancing the skill, diagnostic reasoning, operative planning, management strategies can be increased by joining the grand rounds. We can also learn the professionalism, how to discuss the ethics, the communication, the patient experience, safety, and culture. And the idea of Grand Round is again the community and the mentoring and the system improvement. Today, I am really happy that we are having today my old friend, Dr. Dilip Walke. His profile also says that he has got 3 decades of experience in women health, IVF, and medical legal issues. And what I feel about him, he is always there as a leadership, as a medical legal involvement from the ex-president of the Pune Obegyn Society, Pune, and very good friend of mine. So welcome, Dr. Dilip Walke, sir. Please, you can share.
Introduction was that I'm an old friend of Dr. Kawita Bapat. So that I cherish all those friendships more than anything else in my biodata. Right. So can I share my slides?
Yes, yes, yes.
So this is the topic that I'm going to speak on. So while I say thanks to Kavita, let me start with a disclaimer that basically what's happened. Is it okay?
Yes, sir. It's visible. Yeah. You're audible and visible also.
Okay. Yeah. But the slide is not moving. I don't know why.
It will. It will.
Okay. The disclaimer is that I'm not a lawyer. So I've got no medical legal books to my credit, only a few articles in some of the books that are printed by others. So I cannot approach this topic like a typical lawyer would. I'm going to keep it very simple without any legal jargons. My credibility as the as I was introduced was I was the ex-chairman of the Ethics and the Medico Legal Committee of FOXY, wherein I organized several medico legal conferences and small events where I met a lot of legal luminaries, and I'm only made to look like a medico legal expert because of my friendship with these people. And recently, I was the co-author of the Uniform FOXY Consent. So this is what my disclaimer is all about. And you may wonder that if I'm not a lawyer, and why then Kavita considered me worthy of this? Only because of the friendship that she has with me. But why is it that she considered me worthy of this topic? So basically, me along with 2 others, that Dr. Patel, Dr. Nikhil Datar, and Dr. Alpesh Gandhi, who was the president of FOXY at that moment during the COVID time, we formulated what we call as the Uniform FOXY consent. So this is the reason why I'm here to talk on consents. And why did we together thought why we thought that it was important to have this consents for us, and why is it that we are spending almost 30 minutes or even more on this topic of consent? So basically, the reason is if we did a surgery or a procedure without a valid consent, then if the case goes in the consumer court or a civil court, then we are found to be negligent because we have not taken a consent for the procedure. Then we have to give compensation for medical negligence because that is going to be considered as negligence. And if this case goes in the criminal court, then we can even be arrested for assault and battery on the subject on whom we did the surgery or the procedure. So that's very important that we discuss a proper valid consent before we did anything, a procedure or a surgery on a patient. So let's start with what is the definition of a consent. If I was a lawyer, then I would have told you that consent basically is a contract as per the Contract Act of 1872. There are 2 sections which are important that we have to understand. One is section 13, which says a consent is when 2 or more persons are said to consent when they agree upon the same thing at the same in the same sense. Like 2 people are coming together and they decide to do something and they give consent to each other, same thing in the same sense. And it has to be a free consent. And if it is free consent, then it is something which is not caused by coercion, undue influence, fraud, misrepresentation, or a mistake. So this is what the lawyers would tell you. And when the lawyers start telling you all this and they start using the legal jargon, basically we do not understand what does he mean by saying that. So in simple words, for our understanding as doctors, consent is the voluntary agreement of a competent person with capacity to allow a medical procedure or intervention after having given adequate information about its nature, risk, benefits, and alternatives. So, this is the crux of the matter. Consent is simply an agreement between the surgeon and or the doctor and the patient who's got the capacity to consent to allow that procedure or surgery to be done on himself or herself after having been given adequate information about the nature, the risk, the benefits, and alternatives. And where did I find this simple understanding of the consent was simply this case, that is the Samira Kohli versus Prabha Manchanda, which was decided in 2008. Otherwise, there is nothing mentioned in some legal books about consent in medical profession. But if you just read this judgment, you will understand what is consent in our medical practice. Now, what actually happened in this Samira Kohli versus Prabhan Manchanda was that there was this unmarried woman who had pain in abdomen, and the clinical diagnosis was query endometriosis. Consent was taken for diagnostic laparoscopy, and there was no discussion about probable need for an additional surgery SOS. But during the surgery, there was a lot of bleeding on table, and a hysterectomy had to be done. And while doing the hysterectomy, the consent of the mother sitting outside was taken. So basically, this surgery was done without the consent of the patient because the patient was under general anesthesia and the patient was taken up only for diagnostic laparoscopy or endometriosis. So the Supreme Court was moved here. Hysterectomy, which was not a life-saving step, was done without the consent. And I'm not going to go into the details of this case, but let us try to understand what the Supreme Court taught us about valid consent. Supreme Court told us three things. One is the patient who's giving the consent should have a capacity to give consent, which means the patient has to be more than 18 years of age and not insane. If the patient is less than 18 years of age or patient is insane, then the legal heirs are supposed to give, the parents have supposed to give the consent on behalf of the patient. Second point is voluntariness. It is the patient who signs and not the mother-in-law or the husband or the father or the brother. So signature of the patient is more important. And third point is knowledge. Patient has to be informed about the surgery or the procedure completely before actually doing the surgery and before the signature is taken on the consent. So these are the 3 points. And instead of actually going into the details with all the legal jargons, let's have some rapid fire questions which will make you understand what I mean by these 3 points. One, consent for LSCS on a 23-year-old female who signs the consent form for her. Is it the husband or it is the mother-in-law? It is the patient herself, which means what we are talking about is voluntariness. And the others who are signing are basically signing as witnesses. The patient's consent is the most vital one. Now, supposing if you're doing a collosis fracture reduction on a 10-year-old, then who is going to give consent? The answer is simple, the legal guardian, because the patient doesn't have the capacity to consent because the patient is less than 18 years of age. Now, the third, which is a little googly question, is a 15-year-old child has got cancer and you want to start chemotherapy. Who should give consent for this chemotherapy or even surgery? Because now, after the chemotherapy, it is likely that the child is going to become bald. So, do you think you can just go ahead and take a consent of the parents and give the chemotherapy and the child is going to have a shock that the child becomes bad? So here there is a concept of what we call as a mature minor. This child may be 18 years of less than 18 years of age, which means legally you have to take the consent of the parent. But if the child is mature enough to understand what is happening, then between the age of 12 and 18, I think you should take an assent of the child also and do a proper counseling with the child in the way that the child can understand about the surgery and the chemotherapy. Because nowadays, children between 12 and 18 are even smarter than us and they know about everything on the mobile. They've got a lot of information that is available to them. So I think now when you're operating on a girl between say 12 and many times we do operate on them for a twisted ovarian cyst or something like that, then it is imperative that you explain everything to the child also and take an assent along with the consent that you have taken from the parents, take an assent from the child also. Again, patient enters a gynec OPD for some vaginal discharge. Is written consent required for a per vaginal examination? The answer is no. This is something called as implied consent. The fact that the patient came to a gynecologist is implied that she is ready for a vaginal examination. But again, a googly here, the patient comes in the gynec OPD for vaginal discharge, and for some reason, the doctor plans to do a per rectal examination or the doctor plans to do a breast examination. Is it an implied consent? No, because there the patient is not expecting that a PR would be done and the patient is not expecting that a breast examination is going to be done. So this is the concept of express consent. In a gynec OPD, you need not take even an express consent by actually verbally taking the consent for a per vaginal examination. But if you are going to do a breast examination, then definitely you need to take a consent. I can tell you of a case which has happened in the area that I practiced. A lady gynecologist was examining an unmarried girl with pregnancy, and I don't know for what reason she did her breast examination also. The next day, this lady gets a phone call from this patient that Dr. So and so, you molested me by examining my breast. So, this examination of breast or a per rectal examination, you have to take a consent that is it okay if I examine your breast, whether you are a male gynecologist or a female gynecologist, that is important. Then about life-saving situation, like supposing you had a 25-year-old woman coming in the emergency room with a low blood pressure, with pulse 120, abdominal tender, sonography showing ruptured ectopic, and patient has collapsed, not in a position to give consent for surgery, no relatives around. Can you go ahead with the surgery? The answer is yes, because consent is not needed for any life-saving situation. All you can do is inform the medical superintendent of the hospital if you're working in the hospital. If it is your private nursing home, you are capable enough to take a decision on behalf of the patient in a good faith and go ahead and do the surgery even without a consent. But this is a special situation called as a life-saving situation. Now, can we do certain jugards in matter of consent? I mean, I think everybody knows what is the meaning of jugard. Now, supposing the situation is such that there you started a surgery and there is a death on table, and then you realize that you had forgotten to take a consent of the patient. And now what do? Can you go ahead and take a left hand thumb impression of the patient of the dead body? Actually, the patient would have died now. Can you do that and consider that as the consent? Now, this is exactly what was done in a case from Bombay, wherein the patient had a death on table, and then they later on realized that the consent was not taken. So what they did was took a left hand thumb impression on the consent form. And when the case goes in the court, they come to know that this patient was MA in English literature. So do you expect somebody who was an MA in English literature to give a thumb impression as a consent? So it is basically better to accept, because if you have taken a thumb impression, then that becomes forgery for which you can be arrested. But if you have forgotten to take a consent, then that becomes a kind of a mistake that you have done in consumer court or in the civil court. And at the most, what you will have to do is you may have to give compensation. So it is better to plead in the court that I had forgotten to take the consent in such situation. It is better not to do any kind of jugaad in the matter of consent. So forgery arrest, and if it goes in the consumer court, at the most compensation. This next question that is often asked about consent is written signed consent essential? I mean, see, let's discuss a situation where a surgical case is in the court for some complication and it is found that written consent was not taken. Now, in the good old days, the lawyers used to take a difference, and even we as medical legal experts used to advise our patients, our friends to say that the fact that the patient entered in the OT and slept on the OT table, it is implied that he or she consented to the surgery. But now, after the Samira Kohli case and the many other cases that have come, now it is very well written in the Supreme Court judgment that whenever a surgery is going to be done, then a written consent is needed. So all those defenses that we used to give in the good old days for those consents which were forgotten, now it doesn't hold true. You have to take a written consent. But what about this? In 2020, there was a WhatsApp message that was spreading all over that, which said that signature on a pre-printed consent is not allowed. So, because in the judgment that had come, they said that because in the particular case pre-printed consent forms were used, that's why it amounts to an unfair trade practice, and 10 lakhs of compensation was awarded against the hospital. Now, this was that RG Stone versus Vinod Khanna case. Now, this case has gone in the Supreme Court as an appeal, and there is a stay on the judgment that had come from the National Forum. And actually, one of the members of the National Forum is a doctor from Maharashtra, in fact, from the city where I am belong to. And we had an in-person communication with Dr. Kantikar, and he said actually in the judgment he did not want to talk about anything against a pre-printed consent, but basically what he wanted to say was the consent has to be procedure specific, the consent has to be patient specific, and all the blanks had to be filled and options struck out. So this is actually what he meant by talking about a pre-printed consent form, and it was misunderstood by the whole fraternity, misunderstood by the media, and it was spread as if pre-printed consent forms are not I mean, they are just not allowed. But the fact of the matter is, pre-printed consent forms are allowed and you can still use them. But your consent has to be patient specific, your consent has to be procedure specific, and all the blanks and all the options, he, she, was, is, everything that has to be struck out has to be properly struck out, and all the blanks have to be filled. Only then it becomes a valid consent. Otherwise, it is a consent taken in a very lackluster manner. That is what the court infers if such a consent comes in front of them while giving any judgment. So basically, till now, we have understood that consent means proper capacity. Consent is about voluntariness that the patient signs, and we touched upon those important type of consents which concerns us. The other legal consents, forget about them. But for us, whatever type of consents concern us, we have discussed that. And we also have understood that the consent has to be procedure specific and patient specific. But we yet have to discuss about knowledge. What is it that the Supreme Court is expecting us to talk about with the patient about the surgery and about the procedure? And the Samira Kohli judgment tells us, the Supreme Court says, that you are supposed to give an outline of the nature of the treatment, the benefits of the treatment, the substantial risk of the treatment, the alternatives, the consequences of refusal. So consent, they, according to them, is not just about taking signature, but consent is about counseling too. So this is what the court impressed upon us, that consent is about all that. Now, when we tried to understand and when we were actually formulating these consent for over 330 OBGYN surgeries in the uniform Foxy consent, what we did was we actually devised the consent as per the guidelines of the Samira Kohli versus Prabha Manchanda. And we got everything endorsed by not only doctors, but even legal luminary. Like there was one Justice Kaushal Thakkar, who was a High Court, a judge from the High Court, Allahabad, Justice Ambada Joshi, who was a Lokayukta of Goa and a former Mumbai High Court judge. We took opinion from Advocate Shirish Deshpande, who was the president of the Mumbai Grahak Manch. He was a consumer activist. We also took opinion from SM Kantikar, the member of National Forum, Advocate Joga Rao, an esteemed teacher, and Dr. Anant Rao, the head of the department, Maharashtra Law University. So we took an opinion from not just doctors, but we took an opinion from all the lawmakers, and we took an opinion from those consumer activists also, on the consent that we formulated for our delegates. But when we were talking about this, about the knowledge part, and the Supreme Court told us that we are supposed to give an outline. So we were discussing about what is it that the Supreme Court means by saying give an outline. Is it a USA standard wherein you're supposed to inform everything, which is the typical informed consent, or is it the UK standard where it is a balanced information, which is what we call as real consent? The informed consent is what the patient would want to know about everything. The patient would want to know whether I am likely to die or during the surgery also. So this is informed. And the balanced consent is what the UK standard says, wherein you give only those information which is not going to put off the patient. So a very balanced way of consent. So that is real consent. And then the second point that we were discussing is what is the meaning of substantial risk? Is it a risk that is more than 2%? Is it a risk that is more than 5% likely to occur? Or is it a risk that is more than 10% likely to occur? And one of the cases that was mentioned in the judgment was an English case which had mentioned that you have to mention only those risks which are more than 10% risk. So we thought that since this case was mentioned by the Supreme Court, let us talk about those complications which are likely to occur with a probability of more than 10%. So this is what we actually thought about everything that was mentioned in the Supreme Court judgment, and then we went ahead. Why is it? Yeah. Now, Supreme Court, then we realized that Supreme Court is actually not, you will be surprised to know that anybody who comes as a medical legal expert and talks about consent in India, he talks about an informed consent. But you will be shocked to know that the Supreme Court does not expect consent in India to be an informed consent. We are supposed to take a real consent. We are not supposed to mention all the remote and theoretical risk of the procedure that the patient becomes afraid of the surgery and runs away. We are not to mention the remote and theoretical risk of the refusal of the consents that the patient is ready to do any kind of a surgery. We are supposed to strike a balance. And as medical legal experts, we were very happy because now we came to know from the judgment that the country doesn't expect us to take a informed consent. So we were very happy. But having said that, during a very personal interaction with some of the legal luminaries and the members of the National Quorum, they said that in this new era of information, it is prudent, they said, to have a complete and detailed information, informed consent, especially about the risk. So even though the Supreme Court judgment says that an informed consent is not needed, actually what they meant was it is better and prudent to have an informed kind of a consent. So we were confused what to do exactly. In our Foxy endorsed consent, that's the reason why we have tried to strike a balance between informed consent and mere real consent. So what we have done is the informed consent, the Foxy consents for any of the surgery has been drafted in two parts. One is the undertaking, the typical signature document that we call consent. In our layman's language, if I were to tell you, get me a consent form, the sister will get that consent where the patient signs. That is the typical signature document कि मैं इस surgery के लिए तैयार हूँ, I have the complications have been explained to me, X, Y, Z and all that, and there is a signature. And the part one, which is the important part of the consent, is information of the surgery, the document to prove that counseling was indeed done. So what we will do is, what we have done is every surgery that we have drafted the consent form has all these points. These are as per the Supreme Court guideline. The name of the surgery, the meaning of the surgery, the purpose or indications, the common list, the description of the procedure, the benefits and effects, the alternatives, the consequences of refusal, and the outline of substantial risk. So the salient points of this information that we have given is the headings are as per the Supreme Court guidelines, as I told you. Information is given in a very easy to understand layman's language. If you pick up those consent, you will realize that it has been drafted in a very simple layman's language. The Nasik Society has translated it in Marathi. The Hubli Society has translated the consents in Kannada. And nowadays it is very easy to put it on ChatGPT, and the ChatGPT will translate for you within no time. We have drafted separate consent for anesthesia and blood transfusions. Some consents in addition to provisions of the MTP Act and ART Act. There are provisions of consent actually drafted by the government for MTP Act and ART Act. But yeah, in addition to that, those consents, we have also formulated information for, say, an ovum pickup and information for MTP, information for embryo transfer. So all that is there. We have done that, and information of even a dreadful complication were drafted in a positive manner. For example, if a patient comes to me and asks, say, there is an incidence of 0.1% chance of death on table on a particular case, is it that we are supposed to tell them that the chances of you dying on table is 0.1%? No, that is not a positive way of presenting it. The positive way of presenting it is the chances of you dying on table is very less. So the same information has been given, but the second time you gave it in a positive tone. The first time when you said that you have got a 0.1% chance of dying is a negative way of telling. So we have taken care of every little thing while we drafted the information booklet. Let's take an example of abdominal hysterectomy here. You can extrapolate it to any surgery. You can extrapolate this, what I'm going to discuss it on for vaginal hysterectomy also. And I'm not going to discuss the abdominal hysterectomy or any hysterectomy in detail. I'll just tell you what have we actually included in the information that we have given on abdominal hysterectomy. First is the name, whatever. And we have a very आपका मैं abdominal hysterectomy with BSO करने वाली हूँ, but they don't understand what is the meaning of abd hyst with BSO. So first is the name of the surgery that has been planned for the patient. Then the meaning. What is the meaning in simple language of an abdominal hysterectomy of BSO, that is bilateral salpingo-hysterectomy, which means we are going to remove your tubes and the ovaries in the simple language that the patient will understand, and then the indications of the surgery, then the description of the procedure. Here we are not talking about how to take the incision and what are the layers of the abdomen. Simple languages may the abdomen is going to be opened, and then what are the steps of the hysterectomy in very simple language we have to tell. The benefits and the effects of the surgery, of effects of removing the uterus, the effects of removing the ovary, the effects of removing the cyst if it was there, the effect of removing the fallopian tubes and the need to remove the fallopian tubes. All these things have to be explained in the consent. Then the alternative. Now, this is a very important part of it, which we tend to ignore. Like if you are some passionate vaginal surgeon, then you are going to talk everything positive about vaginal surgery, but you are not even going to talk about abdominal hysterectomy. If I am a very passionate laparoscopic surgeon, hysterectomy surgeon, then I'm going to talk only positive about laparoscopic surgery, and I will not even mention about vaginal or abdominal hysterectomy. But when you're taking a consent, you have to talk about all alternatives, not only the medical therapy that may be available for this patient, and then why are you decided not to go for medical therapy in the particular case, that you have to take it for a long time, that there are problems with it, that you have to discuss. Other surgical procedures, like if you are doing a hysterectomy for a fibroid, you must also talk about myomectomy and why myomectomy has not been decided in the particular case. Other modes of hysterectomy, if you're doing an abdominal, you have to talk about vaginal, you have to talk about laparoscopic hysterectomy also. Consequences of refusal have to be explained, that if you don't do this surgery, this is what is going to happen to you. An outline of substantial risk. Like if you can see the slide, you will realize that we have talked about bleeding and clot accumulation. We have talked about infection. I mean, it's a very busy slide. You can go on the Foxy website, download it, and you will read it. You will realize that everything that I'm mentioning has been mentioned in a very simple language. Injury to surrounding structures, anesthesia risk, scar complication, and very rare condition. Now, very rare condition includes everything. No? You can die on table also. You can have a embolism also, and suddenly because of embolism you can die. You can have injury to structures also. So how is it that you capture this very rare condition? Can you say that you've got 0.001% of dying? You can so many percentage of you having a pulmonary embolism. Can you do that? So just have a look at the way we have described the very rare complication. And we'll read this slide together. The slide says that allergic reaction to any drug, including anesthesia medicines, blood transfusion, need for assistance for respiration, oxygen and ventilation, shock, stroke or heart attack due to strain on the heart, fluid collection in the lungs, formation of blood clots in the veins, leading to embolus, further leading to damage to vital organs, loss of function of any limb or organ, or paresis are extremely rare but not unknown complications of any surgery. We have already informed them in form of an informed consent, but in a positive tone to say that they are extremely rare but not unknown complications of the surgery, which means bata to sab kuch diya hai, but in a very positive tone. So this was about the information part of the consent. Then we came to the undertaking and what changes we wanted to make in the undertaking. We will try to, this is the typical consent form that we have, but we have made a lot of changes in the consent form. You can download and you will find, and we'll discuss that. Some of the important points in the undertaking that we have inculcated and we have put in the format is first is about additional surgery. What we know and believe is, as per the Supreme Court guidelines, this additional surgery in good faith is not allowed unless life saving, which means you put in a scope and you're doing a myomectomy and you found that there is an ovarian cyst, but the consent was taken for myomectomy. The Supreme Court judgment tells us that you cannot do an ovarian cystectomy because additional surgery in good faith is not allowed unless it was a life-saving surgery. And the medical legal expert would always tell you, do the surgery later on. यानी पेशेंट को यहाँ से एनेस्थेसिया से बाहर निकालो, उसको बोलो यार आपको एक सिस्ट भी है, हम लोग एक 2 महीने के बाद में वो सिस्ट के लिए ऑपरेट करेंगे. But if I were to ask some of the seniors sitting here as audience and put your hand on your heart and tell me, have we not in our practice called the relative, the husband, the father or the mother inside the OT and showed them, अरे देखो इसको appendicitis भी है, चलो हम appendix भी निकाल देंगे, इसको ovarian cyst है वो भी निकाल देंगे, इसमें छोटा सा fibroid है वो भी निकाल. Have we not done that in good faith and our wisdom was never questioned in those days? So if we have done that in the past as a matter of wisdom, why can't we do it now? So what we have included in that is a concept called as proxy consent, which means the patient may choose to sign this or the patient may choose to erase this completely. What is it? I'll just read out. I understand that during the course of the surgery, the doctor may find an unanticipated, unhealthy condition that may need specific action, procedure, or surgery. Now, this is not about life-saving problem. This is unanticipated, unhealthy, that may need specific action, procedure, or surgery. If the doctor feels that it will be beneficial to treat such condition while performing the proposed surgery, and if I am not in a mental or physical capacity to give consent because of this anesthesia, the doctor may take necessary decision after discussing with dash Mr. or Mrs. So and so and the relation that of that person with you, husband, brother, father-in-law, whosoever, friend even, and I authorize the above mentioned person to give proxy consent on my behalf. So we have included that the patient may choose to put the name of the person here, or the patient may choose to totally strike it out from the consent. But all those additional surgeries now can be taken care of. Now, when we actually put this in the Foxy Uniform Consent, we thought that the legal luminaries would say, those 5-6 legal luminaries to whom we approached for opinion, we thought that they will say that this is not allowed. This kind of an additional consent is not allowed because the Supreme Court judgment is there of Samira Kohli, which says that this is not allowed. But to our surprise, all of them said it is perfectly okay if you have taken a consent beforehand of a proxy person that the patient is deputing in case of such a problem. So now we have included that the patient may choose to sign, the patient may refuse to sign, but if you get that, then you can go ahead and do anything in good faith after having taken consent from the person that she has authorized. Second, privacy and confidentiality. Now what happens is, especially the laparoscopic surgeon, they perform the surgery at 3 o'clock in the afternoon and at 4 o'clock the video is viral all over. Now, if I were to know that Dr. Walke is operated at 3 o'clock in the afternoon and it is Ruby Hall or it is Jupiter Hospital, is it not very easy for somebody to go to Jupiter Hospital, find out the OT list and find out which was the patient that was operated on that day? So what about privacy and confidentiality? So please be careful when you're forwarding videos and photographs of surgery. You can be pulled up by the patient for breach of privacy and confidentiality. Then how do I protect all those delegates, all those Foxians who are into this kind of a practice of immediately, or even now they're doing it Facebook Live. Now on Facebook Live, you will definitely know where Dr. Valke is operating today in the afternoon at 3 o'clock. It is very easy to find out. And it is very easy to find out who the patient was. So to to protect all those Foxians who are into this kind of a practice, what we have included in that is this point, which says that I consent to observing, photographing, or televising of the surgery for medical, scientific, or educational purpose, provided my identity is not revealed by picture or by descriptive text accompanying them. Consent is this kind of a consent nowadays. We say that in that you take it by default, so that if you have taken a photograph and you are putting it on social media, if you've taken a video and you're putting it on social media, you will be protected if the patient has given this kind of a consent, because you're doing it for medical and scientific purpose. But actually, I don't know whether people are doing it for scientific purpose or people are doing it for their self promotion. That is a different debate altogether. Then how do you prove that the consent that you have taken is indeed patient specific as specified by Dr. Kantikar in the National Forum? So here is a line which says that apart from the above mentioned general information, I have been given specific information about individual risks related to me, like XYZ. The patient may be having cardiac problem. The patient may be having some specific problem. So those problems will be written physically by the doctor. This refers to specific problem of the patient. So this can be actually included in the undertaking part. So now this undertaking consent becomes patient specific because you were careful enough to jot down those points which were specific for the patient. Then language issues. How do you accommodate patient who does not understand our language? Like Hindi, we know English, Hindi, Marathi, but then if the patient is Kannada, the patient is Tamilian, then how do you manage that? Nowadays, with Chat GPT and all with AI, this has become very easy. But for abundant caution, we have included this in the undertaking, space for handwritten declaration by the patient or relative in his or her language that I have been explained the above mentioned by dash the name of the interpreter in dash language and I have understood it. Now the same thing you can do it with an AI who will read whatever we have written maybe in English, then translate it in Tamil, and then an audio can be made to can be played for the patient also in Tamil. So now things are becoming easier, but then we have included this in our Foxy consent. Point 5, consent for surgery by specific surgeon. Consent has been taken under anesthesia by a specific anesthesiologist. But suddenly on the next day, some other surgeon operates or some another anesthetist gives the anesthesia. How to accommodate this event? This happens very frequently in corporate hospitals, or this happens very frequently in medical colleges, because the consent may be actually on the consent, the name of the surgeon may be X, but actually somebody else might operate, or the anesthetist's name may be X, but actually somebody else will operate. So that's the reason why we have included in the undertaking that I am aware that the surgery will be carried out under the direction of dash and the team of doctors and nurses and assistant under this surgeon. And I'm aware that the anesthesia will be administered under the instructions of Dr. Dash and the team of anesthesiologists under them. So now we have taken consent for the team and not for a specific doctor. So that will then you will be protected. Now there is a point which is not included in the uniform Foxy consent undertaking, and that was the point for jurisdiction of the place of the treatment. Because now you all know that if the patient does a surgery in Pune, in my hospital, but the patient is from say Indore, the patient can put a case against me in Indore now, and I'll have to go to Indore to fight the case there. In the good old days, it was that the patient could actually file the complaint in the place where the cause of action has arisen, which means the surgery was done in Pune. The patient then had, I mean, the only proper jurisdiction was either a Pune district forum or the Maharashtra state forum. But now the patient can put a case against me in the district forum of Indore or the MP state forum there also. And I tried my best to convince the other three people who were there drafting the consent that if we are under CPA, our is also a financial agreement. I mean, there is an agreement between me and the patient because for the surgery that I'm doing, I'm going to charge something from the patient, and the patient is agreeing to pay me that amount. Now, if this is a financial agreement, then judicial jurisdiction cause is included in all financial and international draft. So if it can be included in those drafts, why cannot be it included in our draft? So what I tried to convince everybody, ये point हम लोग डाल के देखते हैं that it is like I am operating in Pune, then just put that point that for judicial jurisdiction of Pune area or Maharashtra area, point डाल के तो देखो. This might go in the court, and the court may give a ruling in my favor because the point is there in the consent and you have signed the consent, so you have to put the case in Pune district. If I get one such judgment from my side, that will become a case law. But my friends refuse to put this in the Foxy uniform consent. But if you want, at least I have started doing it in the consent that I am taking for my surgeries, that it is only for the jurisdiction of Pune and Maharashtra and nowhere else. And let us see if there is a case against me and somebody puts a case not in from Pune but somewhere else. Does the judge give me a judgment in my favor? Let's just try to find out if that happens. So I lost my myself 3 against 1 because they said that it is against the ethos of the consumer protection. But the ethos of Consumer Protection Act is about these industries who have got a say a registered office in Bombay, and there are many offices all over the country. So and they are producing products which are sold not only in Bombay but they are sold all over the country. And if there is a defective product, the consumer should be able to put a case against them not in Bombay but in their local area. That is okay for some production. But when a poor doctor who has got a practice in Pune, who has a small nursing home in Pune, he doesn't have all these different kinds of offices all over the country. So the Consumer Protection Act, when it comes to for doctors, then this particular cause of jurisdiction has to be looked into again, and there is a need for advocacy from our side to see that this particular clause is properly mentioned in the Consumer Protection Act. So despite now we have discussed all that and we have made a wonderful uniform Foxy consent and we are very happy about it. But despite that, the patient in the in the court of law can just say that I was suffering and I blindly signed the papers which the nurse gave me and I was given no time to read and understand. Nothing was explained to me. Now, if the patient is going to say कि मुझे तो bleeding हो रहा था, I was suffering from menorrhagia, and because of that I had gone to the doctor and doctor gave me some consent form and I just signed it for a hysterectomy, but मुझे मालूम नहीं था अंदर क्या लिखा है. I was not in a mental situation to understand all that. Now, if that this kind of allegation is made in the court, how what is going to rescue us from this situation? So that's the reason why I thought, can technology come to our rescue? And I'll tell you how I want this to happen. Now, supposing I'm doing an elective surgery, can I send the information and the undertaking part online 2 or 3 days prior to the surgery through an app? There can be app, an Android app on an Android. And can I send this information about, say, supposing I'm going to do an abdominal hysterectomy on Monday, say today is Thursday, and I'm doing it on Monday in Jupiter Hospital. So I can send the information and undertaking online through an app 2 to 3 days prior to the surgery, take a signature on the Android. Now there is a provision for taking signature on the Android. All these Amazon parcels come and we give them signature, so it can be given as patient can actually read whatever has been sent to her and take a signature on both the information and the undertaking part 2 to 3 days prior to the surgery. And this will be stored on the cloud forever. And when the patient gets admitted for surgery on Monday, the Jupiter Hospital can take an additional written consent. So not only you have a written consent signed in Jupiter Hospital, you have a consent that Dr. Walke has stored on the cloud forever. So this can be an e-consent. Now the patient can never say that I did not have time. Now you had this information was given to you 2 to 3 days prior to the surgery. You had enough time to read it, you read it, the information was sent to you on Thursday at 3 o'clock or 4 o'clock in the afternoon, and you signed it the next day, which means you took 24 hours to understand it. You cannot come here in the court and say that I did not understand anything. Now, this will solve my problem for elective surgery. What about emergency surgery? Now there should be provision on that same app to capture and store the audio and video clip of the counseling that I've done on the phone. Like supposing if I have a patient जिसको fetal distress हो गया, if I have a patient जिसको ruptured ectopic है, now I don't have time to do a complete counseling about cesarean or complete counseling about laparoscopy. Total counseling करने को time ही नहीं. What I do is I just talk to the patient, but there is no evidence of what I have spoken. So there has to be a provision on the app where the counseling can be actually picked up, and you have to tell the patient, see, जो मैं बता रहा हूँ ये मैं capture कर रहा हूँ on this app. So you capture that, and that will be an evidence of the counseling done for that emergency situation before the surgery was done. So I think e-consenting is the way forward, and if somebody from our country takes it up and takes up this e-consenting, then I think we will be leaders in showing the whole world the way of taking consent. I mean, it will be not just the first time in our country, but it will be something which will be done first time in the world. So I think the end of it is that e-consenting is the way forward for all of us. I thank you very much for a patient.